Hello, my name is Teresa Tejada, and I am with the National Kidney Foundation of Michigan, and I'm going to lead our presentation today called Vax Facts FAQs. Let's start here. Thank you for joining us today. So Vax Facts and FAQs is a virtual discussion that the National Kidney Foundation of Michigan's REACH team has been having a monthly series on for quite some time now. And we discuss how do we stay healthy and get up-to-date information on flu and COVID-19. And we really are gearing these presentations for individuals with chronic conditions and their caregivers. So this month we'll discuss new guidance about COVID-19 from the CDC. We'll talk about coping with COVID-19, some back to school information, and as always, our frequently asked questions. So first up, the new COVID-19 guidance from the CDC. You might have heard recently that CDC has updated some guidance regarding quarantine and isolation. And so at the beginning of the pandemic, we really didn't have a lot of tools to fight this new virus. So we had to implement a lot of broad, tough measures to keep everyone protected and safe. But now we have a lot more people have some level of immunity through vaccination or recently having the virus, having the disease. And we have a lot more knowledge and resources and tools on how to prevent and treat the virus. So the CDC, they're constantly monitoring what's going on with COVID-19 and have some new guidance, which really continues the transition from these community level measures to more individual interventions. And so it's not a reflection that the pandemic is over. The virus is still circulating, and we'll talk a little bit more about that, but it's just a reflection of some of the new tools that we have available now. And this new guidance aims to minimize the impact of COVID-19 on individuals, communities, and the healthcare system. So this guidance makes sure that we have 4 factors, and that can help us to keep us informed, making informed decisions to prevent severe COVID-19. So know your risk. If you are out in the community a lot, interfacing and connecting with other people, and if you have severe complications or at risk for severe complications, maybe you have a compromised immune system or are older, that's a really important factor to know your risk level. Age, disability status, underlying medical conditions can have increase your risk of having severe complications. Protecting yourself is another important, decision-making factor. So making sure that you're up to date on COVID-19 vaccinations. Up to date includes, your primary series and all boosters. So making sure that we're taking those steps to protect ourselves through the vaccines, and then therapeutics as well, making sure that we are receiving testing, wearing a mask if we're exposed, and we'll talk a little bit more about that later, taking action if we're exposed, and then staying sick. If you are sick or test positive, making sure that you're isolating for 5 days at least if you're infected. And again, we'll reiterate these new guidance in the next couple of slides. So again, we do have the tools to protect ourselves from COVID-19. And it's not just one thing. We have all of these different types of levels and different tools that come together to help improve our success in preventing COVID-19. So, for example, we have lots of personal responsibilities like physically distancing and staying home if we're sick, wearing masks and high quality masks. So those are those KN95s or N95 masks. You can double up on having like a cloth mask and a surgical mask as well. But just a regular cloth mask is not really effective anymore in preventing COVID-19. Hand hygiene and cough etiquette, so making sure you're washing your hands. If you are coughing, coughing into your elbow, avoiding touching your face. And if you're in a crowded situation, making sure that you're, limiting your time, and making sure that there's air, ventilation within that crowded space. And those are some of those personal things that we can do to prevent our risk and our chances of getting COVID-19. But then there's some shared responsibilities. So, like I had mentioned before, ventilation. Whether we are in a crowded space, we're opening up windows, we're having, HVAC filter, or we're doing things outdoors. And these recent guidance about quarantine and isolating can help us with those additional tools. And then, of course, the vaccination programs. Another important tool is our community COVID-19 community levels, and you've seen this for a while probably. It's a very important tool to help monitor what's going on in the community and how widely is COVID-19 being transmitted. So right now, Wayne County's community level is high. So that means that the recommended actions are to wear a mask in crowded public spaces and on public transportation, staying up to date on vaccines, getting tested if you have symptoms, and then if you're at high risk and you have a severe disease, if you're immunocompromised, you might want to take additional precautions as well. So maybe you want to limit some of your time in these crowded areas. And you can talk with your healthcare provider about additional precautions that you might want to take. So what is the new guidance? So the new guidance has some things that stay the same as well as some changes. So what stays the same? Getting vaccinated and staying up to date with boosters. Testing if you have symptoms or if you've been exposed. And just a couple of notes about testing too, remember that you can order tests for free online at covid.gov, and that a negative test doesn't necessarily mean that you don't have an infection, but it just shows that the test didn't detect the virus at that time. So it's best to take multiple tests. Like if you have symptoms, take 2 tests 48 hours apart to reduce the risk of getting a false negative. And then if you're exposed and if you don't have symptoms, then you might even want to take 3 tests, each 48 hours apart. So taking those multiple tests will just kind of make sure that we can catch early if you do test positive, and if you do have the disease, and then you can take all those different precautions, and then also rule out those false negatives. And then additionally, what stays the same is to wear a mask. If you're in an area with a high COVID-19 community level, like we are in Wayne County right now, and again, taking additional precautions if you're at a higher risk for severe COVID-19. So what has changed? There's been some change to the rules or the timelines on what you can do regarding quarantine if you're exposed to COVID-19. So the guidance is to wear a high-quality mask for 10 days. And again, those high-quality masks are the N95s, the KN95s, and get tested on day 5. You no longer have to quarantine if you're exposed, which is, remaining at home, as long as you are wearing those high-quality masks. And then if you're testing on day 5 and you test positive, then we go into our next slide here. So what happens if you test positive? So if you test positive or if you're sick and suspect you have COVID-19, but you don't have those test results yet, make sure that you're isolating from others. Isolate for each other's for 5 days from others for 5 days if you test positive. And if you have had a mild or asymptomatic COVID-19, and if you're fever-free after 5 days, you can end your isolation and make sure that you wear that high-quality mask through day 10. If you've had moderate or severe COVID-19 or you're immunocompromised, continue your isolation through day 10. If you ended isolation, but your symptoms recur or worsen, restart your isolation period back to day 0. If you're confused by all of these timelines, that's okay. The CDC has a website, their CDC website has a quarantine and isolation calculator on it that can help you determine when you can end your isolation and stop wearing a mask. And another thing that has kind of changed with this new guidance is that in most settings, the CDC no longer recommends testing if you're asymptomatic and you have no known exposure. What that means is some workplaces, some schools, they have had implemented like a broad testing program where every day everyone got tested. And you likely don't need to do that anymore. It's just really focusing on exposure and symptoms. Coping with COVID-19 is our next topic that we want to cover today. So, COVID-19 has had a big impact on mental health across all age groups. As we navigate the pandemic, we're experiencing changing symptoms. It's impacted our lives, dramatically, and so that's impacted a lot of our mental health in a negative way. We've got increased stress, and those stress factors can include loneliness, fear of infection, grief, and financial worries. And they can present themselves in many ways, such as feelings of fear, anger, sadness, worry, numbness or frustration, changes in appetite, energy, desires, and interests, difficulty concentrating and making decisions, nightmares or problems sleeping, and even physical reactions such as headaches, body pains, stomach problems, or skin rashes. There are healthy ways to cope with all of these stress factors from the COVID-19 pandemic. These include taking a break from the news, just unplugging, read, go for a walk, take a nap, just getting that break from the constant the constant news about the virus. Taking care of your body is very important. Do yoga or stretching, go for a walk again, go to the gym. Just moving your body and making sure that you're eating right too can help cope with the stresses of the pandemic. Take time to connect with loved ones, call a loved one, safely visit with others, and then take time to unwind. Take time to calm your mind, take care of yourself, and do the things you enjoy. You might need to modify in a different way, but making sure that you are doing the things that give you pleasure. So it's almost back to school season, and as we go back to school, and some schools have already started as well, there's additional guidance from the CDC about how can we have a safe start to the school year. So just to reiterate some things again, stay home if you're sick. Even if it's not COVID-19, staying home still lowers the risk of spreading infections to other people. So stay home, read a book, rest up, whether it's COVID-19 or a different flu or another virus as well. Get tested. We went over today some of those testing guidelines, and test immediately if you have COVID-19 symptoms. And then if you test positive, follow the recommendations for isolation. And if you're exposed, wait the guidance that we just shared says to wait 5 full days before testing and then take those series of tests. Practice good hand hygiene and respiratory etiquette. So help those young ones learn proper hand washing for 20 seconds using soap and water, and to cover coughs and sneezes. Even using a tissue, throwing it away, and then washing those hands. And then masking up. So staff and students should wear a mask indoors if the COVID-19 community level is high, if they've been exposed to COVID-19 or if they're returning from isolation with those time frames that we talked about earlier. So schools are safer when students and staff are up to date on their vaccinations. all children ages 6 months and older are eligible for COVID-19 vaccines, and children's 5-year and older are eligible for boosters. So if you haven't talked with your healthcare provider yet and gotten those vaccines, make sure you do that at your next well child visit, or you can also, depending on the time frame, if you've already gotten your child's vaccinated, it's wise to get a booster as well. Not many people are getting those boosters, so it's super important to get those boosters. And while we're at it, COVID-19 vaccines are important, but also all those regular traditional childhood vaccinations. So don't forget about those as well. Now we are going to go into our frequently asked questions portion of our presentation today. And while we have some questions that are we've heard about in the community when the Kidney Foundation has been doing its outreach, if you have a question yourself, you're welcome to put it in the comments, and I can try to answer it for you live. And the other thing, I'll go back to that. So some frequently asked questions. So does the new guidance mean that COVID-19 is over? And as I had mentioned before, the new guidance is more about the monitoring of the pandemic, those treatment and prevention measures that are now available. The virus is still circulating, so those risks still remain. But however, with the tools that we discussed today, the hope is that people are ready and able to assess their risk and make decisions from there, to be able to live lives in a safe manner. So the guidance does not reflect that COVID-19 is over. It's still circulating. How does the new guidance affect those who are immunocompromised, such as if you have a kidney transplant? So the new guidance may make some people feel like they're being left behind. Understandably, if you're one of these people who are at a greater risk of COVID-19 complications, the pandemic might seem far from over, and it can be really frustrating. But these new treatment and prevention tools that we've talked about are also, very beneficial for individuals who are immunocompromised. Those treatments are things like Paxlovid, you might have heard that, and some of those other treatments that are available, like monoclonal antibodies. So continue to talk with your healthcare team if you should take any extra precautions, especially when the community levels are at medium or high. And make sure that you have extra masks and tests on hand. You can, and I'm going to put on the website for extra tests right now on the screen. So visit covid.gov/tests to order those home tests for free. If you have insurance, you may be able to get tests from your insurance company as well for free. And you can, purchase them from your local pharmacy as well. And the covid.gov website also has information about treatments, but you can also, it's very important for individuals who are immunocompromised to be aware of the treatments options that are available. And if you go to kidney.org/COVID-19, there's some information about COVID-19 treatments that are available as well for individuals with kidney disease. And remember that these treatments are effective early on, so it's important to test if you've been exposed or feel sick. And then another tip for individuals who are immunocompromised is to encourage others to test before coming to visit you as well. Our last frequently asked question today, you might have heard a lot about in the news, is this bivalent booster, and should I get it? Like, what is it? So bivalent booster is a booster vaccine that was being worked on, and it's authorized in Europe. And this booster would target the Omicron Omicron variant, which is the dominant strain that's going around right now, and other dominant variants. And so more information about the bivalent vaccine is to come. We'll be sharing it with you on these Vax Facts and FAQ sessions. But it might be available in a few weeks. And so if authorized, this booster could provide great protection against Omicron and prevent a lot of infections. The current boosters are also highly effective. They prevent in preventing serious disease, hospitalization, and death. So if you've gotten a booster, um, that's great. You don't have to worry that you are not protected. And we'll be able to share some more information about the bivalent booster soon. Thank you for joining us today and taking the time and listening and staying up to date on COVID-19 news and information. If you have any questions or feedback about these presentations, you can send us an email at reach@nkfm.org. You can also visit nkfm.org to share some information to see more information about COVID-19 and flu. And if you're interested in our next live stream, you can watch it on YouTube at the Kidney Foundation's YouTube account, but you can also register at nkfm.org/COVID-19 so we make sure that we can send you those reminders. I hope you have a great rest of your day and a great rest of your evening, and we hope to see you next month.